mitts, and the guy that holding the mitts sort of blocked my throw by directing the force downwards very forcefully. It hurts a bit for a couple of weeks, and I basically forgot about it, and I was in great shape then and trained a lot, and then years went by, and for a couple of years ago it's just getting worse and worse. And basically I wake up every night with a really
how old is the injury?
Sorry?
How long?
For how long?
Yeah.
2 years.
2 years.
2 or 3
okay.
years. And it's getting worse.
Scale from 1 to 10, how's your pain?
Nightly pain.
Like right now?
Right, 2 or 3.
Okay, so it's
but
low.
it's when I move, it's not the rest pain as much as movement.
We'll move it for everybody. Let's watch your range of motion.
Yeah, okay.
So raise your arm up if you don't mind. Okay, can everybody see? Can we do shoulder abduction?
Yeah. Hands down, hands up.
Let's do it. Yeah, let's do it like that.
And it hurts basically from here all the way up.
From there to all the way up.
Yeah.
What's your scale from 1 to 10? What's your pain?
Let's say 4 or 5.
Okay.
But night-wise is worse.
Okay. So I'm on a plane tonight, otherwise help. I'll have the sit for a second. Thumb up, give me a supraspinatus. Press up. Okay, you're pretty strong. Press. Oh, sorry.
Worse pain.
Worse pain. Someone requests worse pain. Okay, thumb down. Everybody knows all the tests. Okay, so even though he's strong, he's not really engaging really well. He's got so much muscularity that he's overpowering the examiner because I'm 185 pounds and I'm, I don't want to like lean on the guy. So we all saw what we saw, right? Okay. So vagus nerve. So let me show you the protocol. Now, why am I doing vagus nerve? As a matter of fact, I'm going to go on the left side. So I don't want you to think because I did it on the right side that I got part of the shoulder. So on the left side. So I'm going to go from the medulla oblongata down through the transverse colon. Unless you want me just to fix the shoulder and then do vagus on somebody else. Your call. What do you prefer? God,
Do Vegas.
Do Vegas. Whatever it stays in, happens in Vegas stays in Vegas. Okay.
And here I tore my hip major a couple years ago, completely.
Nice.
So
Incline bench press works.
So horse polo. Got a horse over me.
So medulla oblongata down through the transverse colon. It'll be different on the right side, but I'll show you that in a moment. So it's really over his nipple line because remember you're going to get the phrenic nerve in the middle. So you got the mediastinum, phrenic, and then the vagus nerve. Now, I'm going to have him give me a physiological sigh. So physiological sigh is real simple. It's what they teach the SWAT members how to calm down in stressful situations. Andrew Huberman does a great job. He talks about it like every week. 2 quick breaths. Hold that and slowly release it. Okay, bring it back up. And one more physiological sigh. And so it's the ability to control his breathing so it'll sync with what I'm doing with the vagus nerve. So I did the vagus, now I'm going to go into carotid foramen, or the jugular foramen is more appropriately called. And then I'm going to go in the auricular portion of the vagus nerve. It's 1/100th of the nerve, but in that 1/100th, it's got more nerve roots than any other part of the vagus nerve. So I'll put it in his ear, and I'll show you how to do the right side in a second. I just don't want to do it, so raise your arm up.
There's a difference.
Good. Raise your arm, shoulder abduction. Remember the pain above. What's wrong?
Well, I'll say it. I feel like I can get it higher, and I don't have the feeling of.
No, I didn't hit the area. I just did the vagus nerve because what do? We balance his autonomic nervous system. So, muscle test, please. Come up. Come on. I can push him down with 2 hands if I did a tricep press down.
Less pain.
Thumb up. Remember that was also.
feel a little better, 10% better, but still there.
Still there, but
Yeah.
you're feeling improvement, and I didn't do his area. I did the vagus nerve, so I'll do the right side. Does anybody have any questions on the protocol? Yes, ma'am.
So it's okay to do it through clothes?
That's a great question. I was waiting for somebody to ask.
Because
It's
I've
always,
always been told skin contact.
of course, you've been told. Look, it's better on skin. But the reality of the situation in the private practice is, I'm not getting skin with everybody. So it does go through the clothes. There's billions of photons being sent out. There is a scatter. As long as one photon gets in, that sends the cascade. So is it better? Yes. Is it reasonable that it's going to happen all the time? Real practice. You know, it sounds better in a school setting. They'll say, "Oh, we'll get people aren't going to remove their clothes." And every FDA clearance, and there's 21 of them out there that Erchonia got, was done without touching the skin because of that concept. So let's go to the right side.
When it comes down, this is the most painful.
Okay.
Just when it comes down.
So let's do the right side. Same thing. We're not going to do the breath just to save time. Medulla oblongata,